Providing unique perspectives on civil preparedness and emergency response. This is Mitigation Journal, the All Hazards podcast.
Welcome back to Mitigation Journal, the All Hazards podcast. My name is Rick Rosati. Today we're going to talk about 3 things you need to do to prevent getting sick or worse from an intentional or naturally occurring biologic event. Now, biologic events can be natural or intentional. The intentional kind is what you learn about in a WMD class or weapons of mass destruction training program, or sometimes you read about these things in the newspaper. The naturally occurring kind, SARS or pandemic influenza, for example, are the kind that go on almost every year, and sometimes we just don't pay a whole lot of attention to those anymore. One is intentional, one is natural. Both can be deadly. Both have lessons to be learned from. We've seen both types in the last 10 years, SARS and West Nile virus, naturally occurring things. We've seen anthrax, an intentional attack, and again, situations that have things to teach us. But did we really learn anything? Today, many documents and memos are urging us to get ready for flu season, get ready for H1N1 or pandemic flu or some such thing. SARS hit the world way back in 2003, and what did we learn from then? Swine flu gave us a run for our money just a few years ago, and really, what did we learn? It's way past the time for getting ready. We have to be ready. It's not as hard as you'd think, and you don't need dozens of pages of a plan either. There are similarities between naturally occurring events and intentional events that we can use to hone our preparedness edge. Even the traditional domestic preparedness training can be translated into natural event readiness. Unfortunately, most of the WMD or terrorism training that has gone on has been a waste of time and preparedness dollars, money spent on big shiny things and security cameras rather than the true looming threats. Traditional responders in the public health system is marginally better prepared today than it was in September 2001. That is, after anthrax, after SARS, after the swine flu. The Centers for Disease Control and Prevention has estimated that a large percentage of our population could fall ill with the next pandemic. That's a large percentage of the average population, not to mention those with risk factors, comorbid diseases, or those that can't have access to vaccine or medications. There are 3 things you need to do today to be ready for the next biologic event, whether it's natural or intentional. Number 1, train your people on infection control procedures and do it more than once a year. Make it part of your ongoing training. This is a good time to develop the workplace practices of cleaning our vehicles and disinfecting our workspaces to help get people healthy and keep them healthy. Studies have pointed out that practice with masks, N95 or otherwise, that is, getting proper fit and knowing how to put them on properly, is just as important as the annual fit testing we do. So practice with those items. Number 2, promote health and safety among your responders and families. That means getting appropriate vaccine and medications out to the responders and their families. That also means that you have to identify at-risk family members who can't receive those medications or vaccines and take steps to isolate them from infection. Numerous self-report studies have indicated that one of the key factors in getting people to come back to work during a biologic event is to make sure the families are taken care of. And number 3, make sure you have a can't-go-home plan for your personnel. Whether you're in healthcare, traditional response, or non-traditional response groups, you have to make sure you're stocking your stations and your facilities with food, water, hygiene products to keep your people at work during an extended operational period. That is to say, when you can't send them home. Be prepared for additional bunk areas and keeping large numbers of people at your facility. And don't forget to take care of your responders and personnel's family. I'm Rick Rosati. This is Mitigation Journal, the All Hazards podcast. Thanks for joining us on mitigationjournal.org.